of people believe that addiction is a moral problem and that people with substance abuse disorders choose to continue using drugs.
This stigma creates shame, it creates guilt and fear, which prevents millions of people from getting treatment. ABC 13's Emily Swecker spoke with a local woman who has spent years battling addiction, and she has a message for other women.
There's a saying in Narcotics Anonymous that says the therapeutic value of one addict helping another is without parallel, and nothing could be more true.
That's why Haven Miller is sharing her story about her struggle with substance abuse and her path to recovery. Miller was in the Army Reserve, attending college and working full-time when a tragedy turned her life upside down.
I was doing really well, but then my sister had a really bad car accident, and she was hit head-on by a tractor trailer, and she was the closest person to me.
She became addicted to the Xanax, Adderall, and Tramadol prescribed to treat her anxiety and depression after the accident.
And I never set out to be an addict. I don't think anyone sets out to be an addict.
But after finding out she was pregnant, she reached out to the Center of Addiction Medicine in Lynchburg and started to turn her life around.
We are working with pregnant women and postpartum who have problems with addiction, and working along with the neonatologists and pediatrics to try and have a seamless program to care for the mothers and for the babies.
The program is the only one of its kind in the area, receiving 1 to 2 new patients. That's an addicted mother and her baby each week.
It completely changed my life. I'm 100% different today than I was then. I celebrated a year clean January 26th.
The program helps mothers withdraw from the drugs they're abusing and helps babies recover from neonatal abstinence syndrome.
We do know that the mothers that nurse, the mothers that do have the skin-to-skin seem to have, the baby has, some of them have not had any development of NAS. Others have had milder cases of it, so that's really important.
Patients also have access to personal counselors, group and individual sessions, and a support group to make sure they continue making progress.
The reason that I'm doing this is because I want other women to get help. I want other women to have the opportunity that I had. If not for this program and this and the help that was available, I don't know where I'd be today.
If you or someone you know is struggling with addiction and is pregnant or has recently given birth, Center of Addiction Medicine in Lynchburg may be able to help. You can contact Centra or your OBGYN for more information on how to begin the program and get your life back on track. In the Lynchburg newsroom, Emily Swecker, ABC 13 News. Patty?